Right, let's review the terms closed and open chain movements. Some people will argue one is better than the other for rehab or for training. I tend to reject that. I think they are both useful in all situations. I mean, not all situations, but specific situations. So typically it's relative to what end of the muscle is moving, right? So we have two attachment points, the origin and insertion. The origin, which is the proximal attachment, is usually stabilized or is not moving, and the insertion usually moves. So think if you flex and extend your elbow joint right now, your shoulder region or the proximal attachment points of your biceps brachii and brachialis are not moving, and the forearm is moving up and down. So some people term regular muscle action is when the proximal bone or the origin attachment is stabilized and the distal bone or the insertion moves. For example, a lat pull down, or I said, as I just explained, elbow flexion. Reverse muscle action is when the distal bone or the insertion is stabilized and the proximal bone or the origin is moving, such as a chin up, right? You're grabbing the bar, so your forearm is not moving. You are pulling your entire body up to the bar. And that is a closed chain movement. So in both these cases, the knee is extending. So in the left side, she is extending her knee and having her foot move, right? So the distal portion is moving and the proximal portion of the attachment of the quadricep muscle group that's responsible for knee extension is stable. So that left side is an open chain movement, and the right side where her feet are planted and she's lifting out of the stool, still the knee is extending, but the distal portion is stationary and the proximal portion is moving. That is considered a closed chain movement. So here are two examples of open chain. The proximal is stable and the distal is moving. So on the left, even though he's moving a rubber band, it's still, or a TheraBand, it's still moving. It's as if he has a dumbbell in his hands. That is still an open chain elbow flexor movement. On the right, the dumbbell is moving, and so that is an open chain elbow extensor motion. Here are two closed chain movements where the distal end is stable and the proximal is moving. So again, a chin up, you're pulling your distal or your proximal portion of your body up to the bar. And on the right side, right, your body is moving towards those hands, which are the distal portion, which are stable and not moving.